everyone, it's Elizabeth. I see we have a couple more people joined us. We have a couple of call-in users that I'm not seeing that are connected to their the internet portion. So I will try to unmute you one by one just to see if that's any of the people who sent their presentations, and we can go ahead and get started. All right. Colleen, are you there?
Yes.
Ah, okay. This worked for at least one person. Awesome. Well, I thank you guys all for being on the call today and for the second part of our ALP project presentation. I am going to go ahead and turn it over to Colleen to talk a little bit about what she did since we were all together in March. So let me I will find your presentation and pass the baton over to you.
Okay.
Here we go. Hold on one second. Panelist.
Okay.
Okay, and you should be able to change your slides.
Okay. So I just put a few slides together to kind of help in walking through my project, which was getting started on grassroots advocacy briefings for our health centers and for them to distribute beyond that. So the goal that I was hoping to, or that I kind of identified out front, was that I wanted to increase our engagement with a lot of different people, and kind of identified all of the different people that might require different strategies to reach. And so one was to expand our engagement with health center staff. I should have mentioned at the beginning, I work with the Primary Care Association in Michigan, and I am our Grassroots Advocacy Network Coordinator. So I work with health center staff on their grassroots advocacy efforts. So I think most other folks in the Grassroots Advocacy Leadership Program are at health centers. So my role and project are kind of different. But so one of the goals of my project was to increase engagement with health center staff members beyond the network of key contacts, because I have a really awesome network of key contacts, but wanted to be able to connect with more staff members than that, since there are so many different skill sets and interest groups and all of that within each health center that I wanted to kind of expand my relationship so that I could hope to kind of find new ways to assist the key contacts that I have at each health center. So that was one goal. And then also getting additional input from clinicians when we have questions about proposed policies or new laws, or need testimony for our state legislature. So I wanted to get clinicians more on board with the advocacy network, and also just kind of more in the loop on what is happening. And then, of course, I wanted to increase involvement by patients in our grassroots advocacy network, since currently most of the patients that are in our network are also board members. And so I wanted to expand beyond just the patients that are board members. And at the same time, wanted to increase involvement by board members, since I was a board member before I joined the PCA, and recall from my time as a board member that I really had no idea of the importance of grassroots advocacy. And so I'd really like to connect with board members and let them know that they have an important role, and that grassroots advocacy is really essential to their job as a board member. And the last goal was to increase involvement by leadership, and also support from leadership, and kind of equip them to do more with grassroots advocacy. So I tried to identify some of the gaps preventing me from reaching each of these groups, and kind of the one that kept popping up with each group was that they need easier to digest information, and then there was something specific to each group. So the staff were asking, this was through my conversations with key contacts at each health center, that they wanted a bigger picture perspective. So instead of just hearing from me when I needed them to take action steps, they wanted kind of a higher level, this is what has been happening, for months leading up to that action step. And I think that was particularly needed at a state level, since they do receive, you know, some regular updates through Access is the Answer when that was the focus. But when we're working on some state issues, they wanted more regular updates. And then with clinicians, I think they wanted depth, but they wanted it really focused. They didn't want things out really muddying the waters with just what are the policy issues right now and what should this particular group of clinicians respond to. And then for patients and board members, I think they both wanted a better understanding of what action steps were being requested and with respect to each different issue. So sometimes it's just a statement that there is no action to be taken right now, but this is what might come up later, so that they can look ahead. So after kind of identifying those gaps, I decided to adapt our health policy committee, comprised of MPCA's board members, which are CEOs from health centers. We had a policy report going out to them every month, every other month, kind of giving an overview of the issues that we'd be talking about at the next meeting. And so I decided to adapt that report for use as a grassroots advocacy network update. And so I just kind of tailored it so that rather than going into quite as much of the nitty-gritty of details on what, like going through all of the steps that had been taken or all of the different possibilities, I just kind of tried to give a summary of where we're at with each of these major policy issues. So I have a table of contents listed here just so that to give an example of like what were the topics in our first quarterly update. And so that included national and state updates, and then also a summary of action steps. And then I got great feedback from that and heard from leadership that they were able to distribute that beyond, they were able to distribute it to more staff than I am able to reach, and so that was really great feedback. And the grassroots advocates said that it was helpful just to kind of, hear from me in between asks, which don't come all that often, but they want to know all along the way what's happening. So they appreciated that. And then I also was able to adapt it again for use with the clinical services committee, so that it was kind of a more focused version on clinical concerns. And so it's kind of, those are the steps I've been able to get through so far. And then my hope for next steps is that I would be able to send this update to board members with a more tailored set of action steps for them to take. And then I also heard from some health center staff that they'd really like it in a format that they could listen to while driving or watch during lunch. And so I might try some of these different formats using podcasts or YouTube or webinars. So that's kind of, that's the grassroots advocacy update was my project, and then I'm hoping to make it more useful for different audiences going forward.
Thank you, Colleen. That is awesome. We are always looking to expand to different formats and all of that. So please keep us posted and let us know if you have any luck with podcasts or YouTube videos, because just having sort of a baseline of what folks would use and would listen to and what would get through to them is always great. And also, I think another thing that you highlighted that's really important is figuring out the gaps before you go ahead and sort of move full speed ahead on any project. We're trying to really be better about that, and just sort of before we go full steam ahead on our next the answer phase or steps or whatever you want to call it, really focus on what are the gaps, what are we missing, where can we be doing better. So that is really awesome, and thank you so much for sharing.
Thank you.
All right. Next up, I am going to try for Kristen in North Carolina and switch up the slides here. Kristen, are you there?
Yes, I am here. Can you hear me?
Okay, awesome. Yes, we can hear you, and you should be able to advance your slides. So next up, we have Kristen from the North Carolina PCA.
Okay, so are you seeing my screen, or am I just advancing the slides somehow?
I'm seeing your presentation. You should be able to advance within WebEx.
Okay.
Or I can, if it's working, I can just try to do it for you.
Okay. Well, I just.
Yep.
Oh, there it is.
Oh,
got it.
there you go.
See it. Okay. Okay. Super. So I just want to thank Colleen. That was a really helpful presentation for me. I'm in North Carolina. I'm also with the PCA, and I've only been here for a year. So Colleen, that was really helpful getting a sense of how you're evaluating your programs and have various types of health center folks involved in your advocacy efforts, and I'm definitely going to use some of those ideas in the future and kind of evaluate our programs the way you have. So thanks for your presentation. I took a kind of a more one specific project that I really wanted to work on. So in North Carolina, we are a non-expansion state, and we're really still struggling with getting attention and leadership at the state level to consider Medicaid expansion in our state. So I really wanted to focus on what we could be doing to engage more on this issue and get our health centers and patients engaged. And let me see where one thing that's just for the broader perspective of where we are, as of yesterday, our state legislature voted to change our Medicaid program. Previously, we were only on fee-for-service for Medicaid and NC Health Choice. The only thing we had managed care for was mental health, and as of yesterday, we will be moving toward a complete managed care model. Well, it's a little bit of a hybrid, but I mean, for all intents and purposes, a managed care model for our Medicaid program. So there's a lot of change coming. It's going to be, slow, a little bit slow, about 3 years. It looks like 3 to 4 years until full capitation for our Medicaid program. But during that time, obviously there will be opportunities where our state can expand Medicaid, and we certainly hope they will take the opportunity to do so. But to get them there, we need to continue our advocacy and keep up media attention and make sure folks realize the importance of this, this policy step in order to better serve the patients in all the communities in North Carolina, or the individuals all throughout North Carolina, and particularly a lot of the patients at community health centers. And just what we hear from our state leadership, for a while our governor, Dr. Corey, was saying he didn't want to put forward a plan or to talk about expansion until the King v. Burwell decision. Well, that was decided, and still we have seen no plan. So, I'll talk a little bit more about some efforts we did around that. But and the Senate and our House at the state level both essentially said we have a Medicaid program that's broken, although that's debatable depending on who you talk to, and that we need to reform the program first. So as of yesterday, we are in the process of reforming, so we're certainly going to keep the drumbeat going of what's next and can we incorporate Medicaid expansion into Medicaid reform. So thankfully, we are a grantee for the ACA Implementation Fund, and our partners in that are the North Carolina Justice Center and the North Carolina League of Women Voters. So we've been working with them to coordinate our efforts around advocacy for Medicaid expansion, or what we're terming more frequently closing the coverage gap, because the term Medicaid expansion is so volatile and doesn't receive a lot of attention in our state, so closing the coverage gap. And then we're also participating with other organizations on a Medicaid expansion coalition where folks kind of let each other know what they're doing around Medicaid expansion. And the strategies of those two groups are essentially to call on the governor to propose a plan, and we worked on that a bit this morning, and now just reframing to say that Medicaid reform should include expansion, and it's missing expansion from its plan. So one of the things this summer was trying to get the health centers more involved in this, because I'm, at the state capitol in Raleigh, and speaking with these other organizations that are also advocating for this. But one of the important things is getting our health centers more involved in engaging staff and patients on this issue. So we had a day of action in July where there were multiple press conferences around the state to call on the governor. This was after King v. Burwell decision to release a plan, essentially saying, you said you were waiting till now, we want you to present a plan. So 2 of our health centers, one hosted an event at their health center or outside their health center, and another had, at least one other or 2 had speakers at the event to talk about the impact on patients and how patients are affected. We also did a call-in campaign where we sent out falsa blasts and got folks to call into the governor's offices to leave messages saying that they're in support of proposing a plan for closing the coverage gap and increasing access to affordable insurance for those in our state. So that's one of the efforts we did to engage folks more at the health centers and individuals. The other thing that's been missing is really that perspective of those who are impacted, and I listened to a webinar with Olivia Riuda from Montana, who did such a fantastic story collection project in Montana, and just was really impressed and touched by the work that she did, and felt that that's engaging the people who are affected is something that hasn't really been done a lot here in North Carolina. So we feel like health centers really have that, they have that reach. They are seeing those people day in and day out. So our effort was, so we decided to essentially just model after Montana and really base our story collection campaign on their model. I spoke with her a little bit more directly about how she did it and that sort of thing. And they put together a story booklet of patient experiences, and then she talked about how there were a few patients who spoke to media, and then there were 2 patients who actually testified at legislative hearings. So just kind of wanted to walk you through how our process has gone and what our original goals were and where we are with that. So we presented a webinar to our health centers, our health center advocacy contacts. So there are most of our health centers have identified someone on their staff who's kind of their advocacy contact and keeps in touch with us on our monthly calls to update them on what's going on advocacy-wise. And so we had a webinar for them to talk about our story campaign and the purpose, and we talked about how we really wanted to use this story collection to educate officials and the public about, what the coverage gap is, who's in it, and how it's impacting real people's lives. Because believe it or not, we have heard from legislators who really, they don't fully grasp that who can qualify for Medicaid and who cannot. They really just don't understand that, an individual can be working full-time and still not qualify for affordable health insurance, and that they might have a very serious chronic condition or a disease that develops and they are not able to get treated. Well, they are, but not in the manner in which they may prefer using the doctors they prefer. So, sorry, I don't put my do not disturb on, so hold on a second, I'm a bit anyway, and then we also wanted to engage health center patients to make sure that they knew it's important that their voices are heard and that their stories are heard, because a lot of these people are really feeling hurt and frustrated that they don't have help. So our goals were to develop a story booklet and identify about 10 to 16 stories to be included. We were going to try to get as many photos as we could, and then also identify 5 to 10 individuals willing to share their stories. And we put together some roles for health center staff. We wanted our contacts at the health centers help us identify like 5 or more patients willing to share their stories and take 5 or more photos that we can use. And then they'd also get authorization forms signed so that they could share that contact information with the PCA, take photos as appropriate, and communicate with the PCA. And then at the PCA, our job would be actually to do those interviews, write up the stories, follow up with the consumers, develop the story booklet, and compile the photos and coordinate individuals meeting legislators and media as necessary. We used a lot of the resources that were shared from Montana, which was wonderful. We also developed kind of a few other resources just for like how to make the ask, how to ask a patient if they're, or an individual you identify in the coverage gap if they're willing to, speak about this, and also who would be following up with them. So to date, it's been slower than we would have liked, but we've conducted 14 interviews, we're drafting stories, we're recruiting another intern and or possibly a student group to help us continue this work as the role evolves, and we're also developing partnerships with other coalition members who may have other resources. We've identified that we're not the best at connecting folks with media. Like if there are reporters who may be willing to do a story and we identify an individual who is in the coverage gap and we think would be a good person to be interviewed for a story, we don't have as many of those media contacts, so we are working with some of our partners to help us identify those so we can make those connections. And overall, just wanted to say that it's been it's a very time-consuming process, but it's been really, really interesting, and it really helps me at least to better understand how this process can also be beneficial for folks, because it does seem like some of these people who fall in the gap really want to talk about, how they can't access what they need and really appreciate having someone listen. And so that's been a really great opportunity to play a more direct role, because usually at the PCA we don't see a lot of these folks directly and interact with patients at the health centers. So that's been a really good opportunity. We certainly have a lot more work to do in terms of fully completing this process, but we do have time because there's not going to be any legislation passed. They'll be wrapping up our legislative session in the next week or week and a half, and there won't be any chance for any legislation that would expand Medicaid until next year. But we're kind of retooling and talking with our partners about how we can really make this project useful and valuable and bring attention to the issue. And also figuring out more how we can engage additional folks at health centers. Ideally, we wanted every health center to contribute, but I realized that there's going to have to be more direct outreach to the health centers to get some of those folks involved in figuring out what the best way is to identify those coverage gap patients and then connect them with us at the PCA. So that's about it.
Awesome. Thank you, Kristen. Just a couple of things I wanted to sort of highlight and reiterate. I think something like story collection is really great, and that is definitely something that if you're at a PCA as opposed to a health center that you can really assist with and spearhead, so that it's not just sort of stuck in the wheelhouse of one health center, and you're getting a variety of stories from all over your state, and you can sort of keep those in your back pocket and use those for more maybe necessarily than just a particular advocacy push. And the other thing I wanted to touch on too was the fact that you're engaging partners in the community and across the state for media outreach and all of those things where you might not have the best connections. And I think that that's a really important lesson, especially for us here at NAC. I mean, we can't do everything without our grassroots advocates and without our leaders like you guys. So it's really important to partner with people who might have those relationships and sort of get to know them, and then hopefully you can form your own relationships with those folks down the line. And I think Medicaid expansion is something that will certainly not be on the back burner necessarily, because yeah, there are states that have not expanded, but even in states that have expanded, some of the programs are going to sunset. So not everything is all sunshine and roses in the states that did choose to expand, unfortunately. So we will continue to keep up the drumbeat on Medicaid expansion. Thank you so much, Kristen.
Thank you.
And I hate to sort of cherry pick, but I'm just looking at folks who I see might be connected via their phone. So I am going to try to pass to Allie Anderson here from HealthNet, and let me just unmute you. Allie, are you there?
I'm here.
Awesome. Yep, and you should be able to advance your slides, so go right ahead.
Okay, thank you. I'm Allie. I am with HealthNet in Indianapolis, Indiana, and I am our Development and Marketing Coordinator. So just some brief background. Like I said, we're in Indianapolis, Indiana. We have 8 primary care centers, OBGYN care center. We have a pediatric and adolescent residency center, maternal fetal medicine, dental, school-based. We have a homeless initiative program. We're a healthy family site, and we do outreach and enrollment. So we are a really broad scope of services here in Indianapolis. We have about 630 full-time staff members. We are located all throughout the city of Indianapolis, and we're kind of spread out. So one of the issues we face is touching all of those 630 plus staff members and all of their locations throughout the city. So that is part of what my project focuses on. So this next slide, you can just see some of what our centers look like. Like I said, they are spread out everywhere, so that's a big problem that we face when it comes to advocacy and getting the word out. So prior to the Policy and Issues Forum, we did not have a dedicated team of staff to work on advocacy. We don't have like an advocacy coordinator here. It kind of just was between myself, our CEO would send out information, our Chief Development and Communications Officer would send an email, and most of those came from NAC, and they would kind of just get forwarded out to staff and say, hey, we need you to help. But we didn't really have a team that was dedicated on making this big push. So prior to the Policy and Issues Forum, we did the e-blast from NAC. We also got signatures from our board of directors, and we did occasional social media posts, so just sharing the information that came out from NAC about call-in days or signing a petition or HR 2 being passed. So not a whole lot going on just because we didn't have a team. So what we decided to do was develop a team of people in our administration offices to really kind of take on this role and develop a team of advocates here at HealthNet. So that includes myself, our Development and Marketing Coordinator, my boss, Kay, who is our Chief Development and Communications Officer, and Dan Wegg, who is our Corporate Affairs Manager. Dan currently works really closely with state and local officials and trying to get them to come out and tour our health centers. So we thought he would be a really great asset to have on our team. So from there, we tried to identify staff at each location or department that would be a good fit to help get the word out. So for example, we have Beth, who is in charge of our Title X program and school-based services. Matthew is an office coordinator at one of our centers, one of our larger centers. Sarah works in our front office staff at another one of our large locations. We have another office coordinator, Misty, at another really large location. Michelle is at another health center kind of on our east side. And Tressa, who is a specialist of registration services at one of our fastest growing locations. So this is kind of the team that we decided to recruit, and what they will do is kind of serve as liaisons for their center. We kind of realized that sending an email from myself, who doesn't really know many of those medical team staffs very well, wasn't working. And although I work closely with them, we don't see each other very often, so an email from me wasn't very personable, and it just didn't seem to be working. So we kind of thought maybe we can find these staff advocates at each center, and if they can send the email, and those staff know them, and they're down the hall, and they see who they are and know who they are, that they might be more likely to read and actually take those action steps that we're asking them to do. And it works out great because many of our advocacy staff advocates, they don't work with patients directly and do more of administrative side, so they have a lot more time in their schedule that they can talk to staff members about making calls, signing the petitions, answering questions that other staff members may not be able to do. So for my project, I decided, like I said, that we would do a team of staff to be liaisons, and they will be the ones that will be in charge of spreading the word to their coworkers via email, word of mouth. They have group staff meetings weekly or biweekly, so those would be great times that they can really push out the action steps and what we're asking them to do. And like I said, we're located all over the city, so it makes it a lot easier that they can send out this email and then walk down the hallway the next day and say, hey, did you get a chance to make the call, or showing people how to make the call and answering those questions. We kind of realized an email from me was seen one time, and then the rest of the week, nothing really happened with it. So these people make it really easy to
to make the call go more than once and get people to continue to participate instead of that one-time participation. So what we're working on now is that our staff advocates are going to receive training on advocacy, and Elizabeth is actually helping me get that set up to come visit and do a full training with our staff advocates and then to talk to our board of directors about advocacy and policy issues that we may be facing. And where I kind of come in with this is when an email comes from NAC, I will help get all the tools out that our advocates need, what they need to say, have the information developed, answer any of their questions, and then kind of push it out that way. So for example, getting the message out from with action alerts. So I've created an image that will be the same thing every time. So when people see it, they know what it is, they know what's going on, why it's important, and then what steps they need to do to help. We're trying to make it the same every time so that they remember what it is and they know right away, oh yeah, that's about advocacy. I need to read this and I need to remember it. So we also wanted to develop some tools that our staff advocates could use if they have staff who have questions. So for example, it can be kind of intimidating for someone to pick up the phone and call Congress and tell them how they feel. So little tools like how to call your member of Congress and the steps they need to take to do it, what exactly it means, what they need to say, where they'll be transferred. An example are really helpful tools, makes them feel a little bit more comfortable, and those will all be developed to send out to our advocates, so other tools that they can use and continue to remind staff to do that. And we'll do the same thing with petitions, sending emails to members of Congress, anything that might come through NAC, we kind of tweak and develop into these action alerts that our staff will remember. So our next steps from here, like I said, is to do the advocacy training with Elizabeth, and that's coming up in October, so we're really excited to have her here. After we do the training, we are working on a plan to introduce the staff advocates to their coworkers and what their roles are and what that means for each health center. We're also working on getting some tours set up with our local elected officials, and we've also talked about doing voter registration, other ways that we can get the word out. So our goal is to really focus on our staff advocacy right now, and once we've got that under control, move into patients and our board of directors and getting that moved forward. But we really want to focus on staff right now. So we are really looking forward to keep working with our staff on advocacy. Not every one of our health centers has an advocate, so we're working on continuing to introduce that, and we started to roll it out into our new employee orientation so that people are familiar with it as soon as they start here at HealthNet. So we're really excited to see where this goes.
Great. Thank you so much, Allie. I am looking forward to being with you guys in a couple of weeks. I think it's really, the slide that had all the different staff advocates is really great because they really did run the gamut from director level to office coordinator, and that just really shows that it doesn't have to be high-level staff engaging in advocacy and pushing messages out. It just has to be somebody who's willing to get engaged and who has the time to do it. And I really like how you broke out the action alert just a couple slides back onto very basic what, why, and how can I help. I think just making the messaging as simple as possible is something that we struggle with, but are always trying to move towards just so that folks know exactly what they can do in as few words as possible to make it as easy as possible for them to advocate for health centers. So thank you very much, and I am going to try to, let's see. We'll go with Wayne. Are you there?
Hey, yep, I'm here.
Hi, Wayne. All right, now next we're going to hear from Wayne Linscott from White House Clinics in Kentucky.
Sure. So greetings from Kentucky. This is Wayne Linscott with the White House Clinics. I presented a couple months ago on our funding cliff push, and this is the second part of what we've been up to. So just a little bit of background. We have 8 sites in central and eastern Kentucky. We started in 1972. We were in the same boat as the previous presenter as far as formal infrastructure on advocacy, so we really wanted to, at least I wanted to on this project, focus on a board-approved plan so that we actually had a path to where we wanted to be, and we would be less reactive and more proactive. So just a quick recap of what I said before, what kind of got us motivated, our data out of Kentucky was really bad. Not many people were participating statewide, and we weren't doing well either. So we still have work to do, but we're getting a lot better. And then the things that we did leading up to the advocacy plan were really about making this whole process less scary. So it's already been touched on a little bit, but really taking what NAC gives us and what we see in the news and turning it into something that's meaningful, that's about our patients and about our health center. So we did a lot of that work, definitely getting advocacy on all of our agendas. But the really big agenda we wanted to be on, and I wanted to be on especially, was the board of directors. So we presented the advocacy plan. We actually did a 6-month advocacy plan at the June meeting, and we laid out kind of that roadmap, which looks a lot like what we've been taught in this program, and we've been working on it ever since. So the first thing that we worked on was a key contacts list, not just at the federal level, but also at the state and local level, so that our message was getting to all the right people. And we've made communications with those folks, and like I said before, we are the key contact for our U.S. congressman here, so we've kept the lines of communication open there. We stole from the Hudson River folks the Enabling Services program, really engaging our Enabling Services employees in advocacy. So we gauged initial interest with them, and of course it was high, and we're working on a training schedule, so really looking forward to that. We identified site champions and had a good turnout. We actually had a good response. Most of the people actually ended up, they work at different clinics now, but they were from the same community, so it was a really interesting development. But we have about 8 people who are interested, so when we need to push information out, they're available to help me out. We also wanted to really define our key issues. I think one of the things in Kentucky that was hard about the information coming to us is that we hadn't really taken the time to identify what our key issues are, to kind of take what's going on in our environment and also what's coming from NAC and turn it into something to where, like I said before, we can be proactive, know what we want to say instead of being reactive. And then also kind of from our perspective, resurrect our efforts in National Health Center Week. And Elizabeth came out and visited with us on one of our days, and we certainly did far more than we've done in recent years. We did fairs, presentations for community groups, and did press releases, so we were really happy with what we did compared to what we'd done in the past. One of the byproducts of this has been that advocacy is more normal. It's not something that's out of the normal work processes. So it's a very simple thing that may seem simple to some folks on the call, but there was a request for health centers to submit comments on some regulation, Medicare reimbursement, and it was just very normal for us, which maybe it wouldn't have been in the past, to present the comments to for the Medicare reimbursement for chronic care management and advanced care planning. So it was nice to see that it wasn't a big chore. It was something we did very normally now. And then it's also engaged our group in more of a conversation with our state PCA, especially around National Health Center Week. So there have been really good byproducts. For us, the things that have really worked have been that standing agenda item. It's not something that's a surprise. It's something that we're talking about often, so it's more normal to all of our staff and our board members. Taking those notifications and getting them down to the patient and health center level has really had an impact, because a lot of times it's very scary. We had board members who said, they were scared to participate just because they thought they'd have to explain complex healthcare issues, but obviously we reassured them. Regular calls with Elizabeth have really helped me in planning. I see things coming long before I did before, and it's easier to get everybody ready for those things. And then bringing Health Center Week back really re-energized our staff and our management, so we're excited about that. The items that still need work, we actually did a review after Health Center Week, and we looked at all of the events. We may do We may keep some of the schedule the same, but we obviously identified a few things that needed improvement, so we're going to make it even better next year. And we also want to do a better job of marketing health centers in general. A lot of our events were geared more towards White House clinics, you know, having a friendly community interaction and not so much explaining health centers, so we want to do a better job of that. The Enabling Services Pilot Program is really important to me because I think it has the most potential for engaging more people, making our voice even louder. We've done a really good job with staff, but we're kind of moving from that staff phase into the, you know, broader community phase. So I'm really excited about that. And then just marketing in general, we really haven't fit advocacy very well into our marketing program yet, and I think there's some really good opportunities there. But overall, a positive outlook for our organization, and we're excited about advocacy into the future.
Great, thank you, Wayne. I know you have a lot of great things going on. It was awesome to be with you guys during Health Center Week. And I think Health Center Week is a really great time. I mean, as you said, you're trying to raise awareness of health centers and not necessarily just White House clinics. But I think Health Center Week really does that, just based on the growth that we see every year nationally. I mean, this year we broke most of our records. We had over 1,600 events. We had over 650 health centers participating, and we had more than 60 members of Congress out to health centers, which is excellent in a non-election year. So we really, I think on a national level and at a local level too, just continue to push and make health centers more visible in communities and also across the country. And also the site champions, and that's something that Allie mentioned too, having somebody at each of your sites, if you have multiple sites, is really key just because it does seem a little bit more personal and it's a little bit easier for you in terms of, you know, a management perspective if you're the person that's sort of spearheading the advocacy effort, to have somebody on the ground at each center, you know, carrying a little bit of your water for you, which is great. So those site champions are really, really helpful. So thank you very much, Wayne, for sharing with us. And let me see who else I can pick on here. Martina, I know that you have a presentation. I'm going to see if you are one of these call-in users. Is this you, Martina? Call-in user 9?
Can you hear me?
Yes, I can hear you.
Okay. Okay, that's me then.
Okay. I'm going to pull up your presentation and let's see. And I can't make you a panelist because it's not synced, but I'm happy to move the slides for you.
Okay, sounds great.
All right. Can you see your presentation?
I can see it.
Okay, perfect. Go ahead.
But I don't know if anyone else can.
I think you can, everybody can.
Okay, great. So hi, everybody. My name is Martina Persson, and I work at Open Door Family Medical Centers. We're in Westchester County. Actually, have one site in Putnam County as well in New York State. We have 5 community health centers and 6 school-based health centers, and 2 mobile dental vans as well. All right, so we can, I can move to the first slide. So the second slide, I guess. It moved back. Okay, here we are. So some of the goals.
Sorry about that.
No problem. Some of the goals that we set for this year, I've listed them here, but we began really following all of NAC's Access is the Answer resources and action steps back in October 2014. Before that, we didn't have anyone on staff that really was solely in charge of advocacy efforts. It fell onto several different people. But then I took a new role at Open Door, so I began to really, they were really, really helpful, all of NAC's resources at that time. But what we found out was, because we did we asked NAC to send us a report of how many patients and staff people and board members were signed up as grassroots advocates for Open Door. And the numbers were really dismal, and really surprised by those numbers. Now, it's possible people had signed up and not chosen Open Door as their health center, But we were then, one of the main goals became to really increase our capacity to do grassroots advocacy. And one of my goals was to sign up 100% of Open Doors staff. We have about 350 employees. That was a little bit difficult to do. People don't, it just has not been a priority for a lot of people to get signed up. So we made a decision as an organization to actually sign staff up as in a batch registration, which I still owe Alex that list of employees. But that way, anyone who works for Open Door will automatically be signed up as a grassroots advocate. It's just part of working in this organization, and they'll receive the action alerts. I set a goal to have 200 patients signed up by June 30th as grassroots advocates, and we were able to get 150 patients. So I didn't quite reach my goal there, but when we did the report in March, there were only 19 signed up, so at least it was a bit of an increase. We have also been one of the health centers that participated in NAC's Hispanic Advocacy Project, so majority of our patients are Hispanic and primarily Spanish-speaking, so we have really tried to understand how to best reach that population when it comes to advocacy, and that's been a really helpful experience as well. And Alex has been here to do training with some of our key staff. What we've learned is that having that part of the population sign up as grassroots advocates might not be what works best for them, but we are trying to really engage them in other ways, like going along on advocacy visits with elected officials, collect stories, take pictures, and then it becomes our responsibility to make sure that their stories are heard, and we'll have to advocate for them. We do engage our patients a lot, like I mentioned, in both state and local advocacy efforts. I'm part of several county-wide coalitions where different nonprofit and service organizations really align their advocacy efforts. So we have, we are more powerful when we lobby the local government, and we all represent the same population basically, but with slightly different issues. That way, we also develop partners in the community that we can call upon when we need help. So when I was collecting the local support letters to send to our members of Congress back in spring, then we had a lot of partner organizations that were very eager to support us, because we've also provided support to them in the past. In New York State, we're lucky to have Chicanes, which is our primary care association, and they are also very helpful in statewide advocacy efforts. And there is, we participate in 2 advocacy days at the state capitol in Albany, and this year we were really hoping to bring a lot of patients along on that day so that they could directly interact with our elected officials. And there'll be some pictures in later slides that show pictures from that day. We were very successful, and we also brought a whole bus full of 25 middle school students to the school-based health advocacy day in Albany, and we held a training for all of those students beforehand about the government and how it works, and what, we kind of, they got to practice a little bit in telling their stories, because they were very nervous, but they all did really great. And we're hoping that we can create that culture of advocacy early in life, and make kids feel like they're empowered and that they can that their voices will be heard. Okay, so my second goal here was to cultivate relationships. Sorry, I'm still on my bullet points.
That's okay. I'm sorry. I didn't mean to hit the button.
That's okay. So my second bullet point here is cultivate relationships with elected officials and their staff. That was one of my goals, was to really learn the names of important staff and develop a relationship with them. So whenever I've been in contact with anyone, made sure I write down their name and follow up with an email. And then I've done a lot of LinkedIn stuff, so I've looked them up on LinkedIn. I feel a little silly sometimes, but right after I've made an appointment or had contact with somebody, I would look them up on LinkedIn and connect with them that way, just to kind of remind them of who my name and Open Doors name, so that next time we talk, they might remember. And my third goal was to plan a successful Health Center Week event, which we did, and there'll be some pictures about that as well. And finally, to develop effective advocacy materials. This is something we're still working on, but we have included some information about advocacy on our website, and we're really trying to incorporate it into our patient welcome package as well. Okay, we can move to the next slide. So this picture is of 5 patients from Open Door when we were in Albany on the Chicanis Advocacy Day. They really looked this happy all day long, which was wonderful. It was just a great day, and we got to get a tour of the state capitol, and none of them had been there before. And, you know, the elected officials are, in Albany, they really only wanted to hear from the patients. They didn't want to hear from the staff, really. So it was very successful. All right, we can move to the next slide. This is a picture from our Health Center Week event. We had a wellness event where we did a little wellness class sampler. We have a wellness center at Open Door, and one of the classes we offer is Zumba. So we encouraged everyone that was there to, of course, participate in the Zumba class. In the back, you'll see Sandy Galiff. She's our New York State Assemblywoman, and Omar Herrera. He's our mayor, deputy mayor here in Ossining. And there were a few other elected officials or staff. Nita Lowy wasn't able to come, but she had a staff person representing her at the event. Okay, we can move to the next slide. So what we did during this event at Health Center Week was that we wanted to capture everyone that was there and do something about advocacy. So this was a very simple way to do that. We created signs that say, "I am an advocate because," and then people get to fill in their own reason for why they're an health center advocate. And we made a little photo album, and it's up on social media. This is a picture of our State Assemblywoman, Sandy Galiff, and our Deputy Mayor, Omar Herrera. He's a very young guy. He's in his early 20s, but he's been very quickly sort of moving up in local politics here, and I think he actually just left this job as mayor, and because he took a job in New York State, in Albany, working for the state government. So he is someone that we're really want to keep a good relationship with, because I think he's going to be in politics probably his whole life, and he's just at the beginning of his career, and he's a very good friend of Open Door and health centers. Okay, we can move to the next slide. here's also a picture of, we did these signs in Spanish too, of course. So here's a picture of one of our patients, and also a picture of our CEO, Lindsay Farrell. I think that's my last slide.
Yep, that was the last one.
It is. Okay. Okay, so that's really, I think, the end of my presentation, unless anyone has any questions.
Great. Thank you so much. I just wanted to, again, sort of go back to a couple of things that you said that are really important and great to highlight. In terms of data, we're always happy to provide numbers and help you sign up patients and employees in whatever way works best for your health center. We always get a bunch of questions whether signing up staff en masse by sending us a spreadsheet is illegal or allowable, and it is, so long as you provide the option for them to opt out, and also, of course, let them know that you're going to be doing that, especially when you're using their business email address. It's even more allowable, obviously, than their personal address because you, the health center, owns that. Those social media signs are great. They're low cost, but they're great for visibility on social media. So that's something easy that folks can do, and it gives people a chance to add their unique voice and their story to your little campaign. And also just to highlight the fact that, yes, the deputy mayor is not going to be the deputy mayor forever, and he is probably, like you said, moving up in the world, and it's great to get him hooked on health centers and what we do early in his career, so that hopefully when he is famous and powerful down the road, he will remember us and support us and be a champion for us. So it's really important to foster relationships, even with people that you think may not necessarily be your biggest champions now. They could be down the road. So that is a great lesson. So thank you very much, Marina, or Martina. I think, let's see. Is anyone else on the phone? I think there should be maybe one more person who's unmuted, and I'm not sure who it is because you're a call-in user, but if you are there and want to share about your ALP project, that would be great. Anybody there?
Hi, can you hear me?
Yes. Who's
Hi,
this?
this is Marina. Marina Apt.
Oh, hello, Marina. Go right ahead.
Are you ready for me?
Yes, we are ready.
All right, thank you. I'm Marina Apt from Scenic Bluffs in southwestern Wisconsin. We have 5 different sites, and we serve 4 counties. We're a very rural community health center, but this advocacy project is a lot of fun. I'm finding it very, very educational, and I'm just very enthusiastic about it. My Advocacy Leader project was to hold an event or activity each day of National Health Center Week. My goal was to involve staff at Scenic Bluffs, our patients, and our community. Excuse me, we're under construction here too, so if you hear a jackhammer, it's right outside my window. Sorry. So I began by forming a committee. I didn't do all the work alone. We created a calendar of events of what we wanted to do for the week. We worked within a budget, and we had an awesome, successful week. Every National Health Center week is fun for us, but this one just seemed to have a little more drive and enthusiasm behind it. So what we did, on Monday we kicked off the week by having a staff breakfast. The whole staff got their National Health Center Week buttons, and we kind of gave an overview of who our representatives were, what committees they're on, what parties they form. We also wondered, like, if anyone lived next to someone or knows someone. Like we said, we're very small and rural. And then throughout the day, we sent out emails to our staff, and we had announcements for our patients about health centers, our own health centers in Wisconsin, and National Health Center statistics. We also made some National Health Center coloring pages so we could get the kids on board. They colored in the waiting room, and then we hung them up in our hallways. On Tuesday, the health center recently became partners with a Spanish resource center that's near us. It's called the Lugar de Reunion, and that stands for a place to gather. So we had our open house during National Health Center Week. The community was invited. We served cake and refreshments. We provided information about what the partnership with Scenic Bluffs and Lugar de Reunion would mean. So now we're able to offer dental sealant sites, Affordable Care Act enrollment events, flu shot clinics. So this was really well received by the community. We did invite representatives. Unfortunately, none of them showed, but we did get some press and Jennifer Schilling, who's our senator, a Democrat, in one of her newsletters, so that was a plus. Wednesday was our biggest and busiest event. We had a farmer's market and a health fair that we held in our health center parking lot. And with the assistance from United Health Center, we were able to give $5 coupons to every patient that came in so they could get $5 worth of free produce. We had 2 organic farmers from the area show up with wagons full of produce. We had a couple people from the University Extension office. They had little food and, how to make a healthy plate that kids could play with. We had some of our own staff taking blood pressures and answering health questions. We did have Representative Lee Narrison stop by. He's a Republican from our 96th Assembly. So we got a picture of him in the paper of getting his blood pressure checked at Scenic Bluffs. He also got a tour of our facility. And all in all, it was just a fun educational day for our patients, our staff, and our community. And we think we served over 300 people that day alone. On Thursday, we had an outreach day, and we had a blurb, again, by Jennifer Schilling, who's our senator, over the newspaper, in the newspaper and over the radio. We also had poster boards at 2 local libraries and 2 food pantries. And the blurb that I called it, and it just gives information on the history of health centers. It showed the numbers that we serve, how our impact is on our local community, how many employees we hire, who uses the community center, some of the services we offer, and then also our upcoming events like our flu shot clinics, our mammogram buses, that kind of stuff. So that was just a great outreach. Our community health center has been here for 20 years, and some people still think that we're a nursing home, even though we have great signage and everything. So it's always good to, even though you are dedicated to the community and in the community for 20 years, it's still good to always remind them that we're here and what we do. Then the final day, Friday of Health Center Week, was a fun day. We had the staff dress up as a luau Hawaiian theme. We served pizza. We gave healthy recipes out in our lobby. So we just kind of ended the day the whole week on a fun note. I started working with our HR person to incorporate our advocacy action plan to all of our new staff that are going through orientation. So I get like a 15-minute time frame with them. And this is where I can just ask them who they know, if they have any personal relationships with our representatives, where our funding comes from, because most people, don't have on their community health center cap, and they don't know where the funding comes from and how they keep their job, who we serve. And at this time, we do ask them to sign the advocacy pledge. And so far, just from starting this, I've got 18 signatures already. So that is my presentation.
Thank you, Marina. I am so thankful, and kudos to you for doing so many events during Health Center Week. Something every day is really ambitious, and I am thrilled to hear that it was so successful and that you pulled it off.
Thank you.
So thank you so much. We may have one more call-in user. If you have not spoken already, please try to go ahead. I think I unmuted you. Anybody else there? Okay, maybe not. Well, those are all of the people that I see that have audio that we would be able to hear. So I'm sorry if you are there and can't connect to audio. We would still love to hear about your project, so feel free to email either myself or Alex or even Dorian or Amanda, just anyone on our team, and we will be happy to hear what you came up with since we last were all together at PNI in March. The only other thing I wanted to mention is we would love to highlight the work that you guys have done throughout the last couple of months, and that would be in the form of a blog post, and you can either send us some information and bullets and we can write it, but it would be even greater. We would love to feature you as a guest blogger on our blog if you want to put something together. It doesn't have to be super formal or super long, just something pretty simple that sort of gives a quick summary of what you chose as your ALP final project. We are looking to get those from you guys no later than October 15th, so you have a little bit of time here. And again, it can be sort of just a little summary, or if you wanted to just send us a couple of points, then feel free to do that, and we can put something together for you. Other than that, I just wanted to say thank you so much for everyone for your participation over the spring and the summer and now into the fall. It was really great to chat with you guys and to share ideas. And as Alex mentioned last week, I'm not sure if anybody from here was on the call. I see Erica was, and she presented last week, so thank you very much. We will always try to do something at P&I that will get all of our ALP grads together. So hopefully we'll have some kind of a reception or a meetup in March if any of you guys are coming again next year to the P&I, so we can chat and stay in touch and share more ideas as we move forward. So I think that is it. And again, thank you so much, and we will be in touch for sure. And again, let us know if you would like to do a blog post for us. Submit that by October 15th. Have a good rest of the afternoon, and we'll talk to you soon.